Across the spectrum of industry, from entertainment to farm work to medical workers, harassment affects women. On day 2 of the Essential for Recovery Summit, we're going to look at the disproportionate toll of the pandemic on women, who represent a majority of essential workers. 2 major issues facing women and other marginalized groups are violence and harassment, and the absence of social protections for most informal workers.
My name is Deborah Freeman, General Secretary for the Union of Informal Workers Associations. I am an informal economy activist. And what I want people to understand about our work is that informal economy workers are bedeviled with poverty, inequality, and vulnerability. What we need to make our work or our lives better is for governments to implement social policies that better include informal economy workers in the area of non-contributory social pensions and access to healthcare. Now, I call something matching contribution. Because informal economy workers mostly earn low incomes, it is important for governments to introduce policies that will match up their pension contributions in order to ensure future income security. Now, access to healthcare. Informal economy workers mostly do not have access to affordable healthcare, and this is a challenge. Therefore, I want to call on governments to implement social policies that will take the informal economy into account. Specifically, I repeat, the area of pension and access to healthcare. Among many other things, these are the things we need to make our lives better. Thank you very much.
Mi nombre es Gloria Flores, soy presidenta de la Federación Nacional del Sindicato de la Salud Privada de Chile. Trabajo en Clínica Santa María y a propósito y desde la experiencia que hemos tenido como trabajadores sanitarios es que en esta nueva constitución, tanto trabajadores del sector, tanto público como privados, hoy día estamos solicitando y luchando para que realmente la salud sea en la nueva constitución un derecho para todos los chilenos y chilenas, para todos quienes residen, ¿no es cierto? Entendiendo la tremenda importancia que tiene, ¿no es cierto?, el tener que vernos como servidores públicos esenciales y presenciales en caso de situaciones sanitarias o estados de excepción como el que hoy día hemos vivido. Necesitamos entonces un reconocimiento para esa condición y por el tiempo en que dure estos estados de emergencia que sabemos que además se van a ir repitiendo de forma cíclica. Es por eso que necesitamos que esto hoy día se contemple y se reconozca desde lo económico la seguridad en las labores, que también se pueda dar permisos, ¿no es cierto?, especiales y garantizados que permitan también la movilidad desde los lugares de trabajo hasta y desde las residencias, que sean acceso a un plan de apoyo psicológico además y programas permanentes de capacitación, cosa que no nos veamos enfrentados a tener que tener sobrecarga laboral y emocional. Sin duda que esas son las grandes tareas y cómo promocionar esa salud, que sea una salud, ¿no es cierto?, con derechos segura para todos. Como trabajadores de la sanidad en el sector, estamos pidiendo que en la nueva constitución se garantice la seguridad para los trabajadores y así nosotros podamos entregar los cuidados necesarios a la sociedad cada vez que lo requiera en pandemia o en los distintos ciclos que van a venir hacia adelante.
Our next conversation is with Breed Gould, who is a vice president of Sodexo, a global company that provides care and hospitality services. Breed will share a distinct personal perspective on the experience and needs of care providers worldwide.
Hi, I'm Rena Ninen, and thank you very much for joining us. I am also here with Breed Gould, and we're going to talk about how companies can and should better support frontline workers. Breed, thank you for joining us.
Thank you, Rena. Delighted to participate in this discussion today.
So I guess I wanted to start off and get your perspective. You have such an incredible range of experience. You started off as a nurse and you worked your way up to be CEO of Comfort Keepers and then eventually transitioning to its parents. When we look in terms of care and policies for workers who are on the ground, what initiatives do you think could support women's advancement?
Lots, Rena. I suppose I'd like to think that my experience from being on the front line myself and always being very hands-on right through my management and leadership career to date, that empowering women on the front line, particularly in healthcare, when they're the predominant part of the workforce, is incredibly important. And I think really important, I think to even highlight my own career progression and having mentors that champion women and put out that career pathway for you, which was very much something that happened to me and I was afforded by my previous bosses and mentors. And I think that's really, really important to be able to do that for others. I think in Comfort Keepers and Sodexo, we've lots of experience of showing that, of people starting even as carers and coming into the business as in different roles of supervisors and coordinators, and ensuring that we can adapt to meet the needs of our workforce, male or female, but very much understanding the needs of all employees.
Now, Sodexo was very proactive at the start of COVID and dealing with the early days. I know it's all so unpredictable. Just when we think we're out of it, there's like another turn at this. Inevitably, companies have to be reactive. So what are really the key grievances that you're seeing and addressing during the pandemic? And what do you think the responsibilities are for employees and for investors?
Burnout is the number one grievance, and I would say a challenge more so than grievance. I think we're still managing and living with COVID, as everyone knows. So I think it's that whole piece. How do you ensure that your workforce is continuing to be supported right across all the different new skills that they've had to learn? Healthcare is full of change, and COVID has brought those skills to the fore of where employees and employers have had to work together to learn new skills. We've carers today who've learned to don and doff their PPE, who are looking after COVID patients in the community incredibly well. And I think the responsibility of employers can only be the number one, safety. It can't be anything else. So ensuring that we have the right tools, ensuring that we're listening to our employees who are on the front line and what their experiences are, and learning from that and continuing to modify and change as the pandemic has gone on.
Do you see in any way a trade-off between protecting these workers, prioritizing care of patients, and then also responding to the pressures that you get from management and from investors?
Yeah, and it's a very interesting balance, Rena, and one that we work and manage every single day. And I think that's around educating everybody around you, all stakeholders, because we all play a part. One role doesn't just do this on its own. So it's working with our caregivers, it's working with management, senior management, our investors. And I think once you get that communication piece right, everything thrives. Your employees thrive, your business thrives, and everyone is happy. And from an investment perspective, I think everyone wants to ensure that it's a good, solid brand that delivers excellent care, and that all of those things come with good governance, good guidance, and ensuring that we're always making the right decisions, which can be costly too.
What role do you think dialogue should happen with unions when you look both in terms of the well-being of the workers and the resilience of companies? Where do you see unions fitting into all of this?
I think employers have become much more, I'm going to use the word mature around speaking to unions. I think we've seen that we've all a common goal here around protecting our employees. And I think that story has really evolved, and even with our participation in the Refrain conference with Unicare of really trying to find the solutions to the problems, because we all know what the problems are. We know there's high turnover. We know it's tough to recruit in healthcare and then again into home care. So how are we really starting to talk about these solutions? And it's, there's not one solution. There's many areas that we have to fix. And I think everyone is slowly moving in the right direction. Yeah, I think we need to gather some speed around it, but I think we're getting there, and unions play an incredible role in that. And I think challenge us as employers as well to make sure that, have you thought of this? And, have we listened to our employees? And, is it meeting the needs of our employees today?
You mentioned this entire concept of employers and unions and finding solutions to problems. One of the problems is burnout, as you mentioned at the top of this interview. There's a lot of that. There are worker shortages, high turnover. When you look at your experience and you look at this problem as a care provider, having seen and heard from employees who are in the front lines of this pandemic, what do you see as a possible solution?
I think we need to always make sure we're hiring the right people. So some people can come into care, and we need to make sure that it's a right fit for them as well. That's our responsibility as an employer. I think we need to make sure that we've given them the right tools to ensure that their resilience. There's great resilience needed in care, and I suppose we talk about somebody being caring and compassionate. Resilient is probably now the number one skill set that we need, because they're going into so many different types of care in the community, which we specialize in, has become much more acute, so much iller, sicker patients being looked after at home incredibly well. So the skill set of our carers has gone up significantly. So that can be challenging, because they're meeting so many different types of ailments. And at the end of the day, care is very emotional. We will all, at some point either require care or have a loved one that needs care or know somebody that is receiving care. So I think, in ensuring that we're working together and listening and managing that, and ensuring that staff, the most basic things of, that their work patterns are sustainable, that, they're taking their appropriate breaks and holidays, etc. Sometimes it's really just back to basics. We don't need to get over complicated about it either.
You say back to basics, and you're talking about these basic things that can go a long way. But for so many employers, the problem is the bottom line. What are sort of practical ways that we could give essential workers the money that they deserve, the conditions, the protections? How do we create a realistic plan moving forward that gives them what they need to succeed, but also works within the bottom line?
So I think a caregiver, no different than any other profession. So even taking my own profession of nursing, from day one to maybe year 10 what you're going to earn, what are your potential earnings, and our caregivers should know that too. So having a very fixed pathway that people can strive through, that whether it's through training, years experience, all of those pieces. And then the core basics of working better to get those terms and conditions of, whether it's pensions or sick pay, that they're absolutely included as a basis. But I know we've talked about working with unions. We do need to work with governments too here. A lot of care is funded or supported by governments as well. So it's how we do that, and it's not just around governments paying more for care to compensate for this. It's around how care is commissioned. We talk a lot around care being needed in the morning and needed at night, and it's that split shift of work for caregivers as well. So how do we ensure from a well-being perspective that that's sustainable into the future? More and more people want to stay at home and be looked after at home. So how are we going to meet that demand?
That's so fascinating. A point I hadn't thought of, how care is commissioned by governments, is also an important aspect of all this. Breed Gould, I want to thank you very much for joining us.
Thank you.
Mi nombre es Verónica Velasco Santiago, soy organillera. Nosotros los organilleros somos músicos que tocan en la vía pública de la Ciudad de México. Durante esta pandemia nuestra economía se ha visto afectada, pues nuestro ingreso depende de los transeúntes que gustan cooperar una moneda. Al cerrar escuelas, restaurantes y estar en cuarentena, este ingreso ha bajado un 80%. Como compañeros nos organizamos para trabajar turnando los días e ir entre calles tocando el organillo para que la gente se asomara de sus ventanas y así pudiera cooperar ya sea una moneda o un producto de su despensa o a veces el agradecimiento. Como padres también nos afectó, pues las clases en línea no todos teníamos internet, dispositivos o pantallas. El gobierno ha apoyado poco. El gobierno federal hizo 2 depósitos de 1,500 cada uno, el cual no todos tuvimos el beneficio. También hizo un programa de bajo palabra, el cual no adquirimos, pues era adquirir un préstamo y la situación no era muy conveniente porque estaba complicada la economía. Organizaciones y la ciudadanía nos apoyaron con despensas. La pandemia ha dado un giro total a nuestra economía y para todo el trabajo informal. Hacemos un trabajo vital para la cultura de la Ciudad de México. Debemos ser incluidos en la recuperación económica de la ciudad.
Quiero saludar a todos, a todas y a todes quienes nos acompañan de modo virtual y expresarles que es un honor participar en esta jornada de intercambio y de reflexión colectiva. Como bien sabemos, el impacto de las violencias y desigualdades se ve incrementada por razones de clase, de pertenencia étnica, de religión, nacionalidad, identidad de género, orientación sexual, discapacidad, entre otras, que implican una mayor vulneración de derechos. Nos tocó gobernar, planificar y poner en marcha el primer Ministerio de las Mujeres, Géneros y Diversidad de nuestro país en el contexto de la pandemia del COVID-19. La crisis global provocada por esta pandemia ha impactado enormemente en las condiciones materiales, sobre todo en las mujeres y diversidades. Este escenario nos exige proyectar estrategias comunes para asegurar una recuperación económica con igualdad de género. Cuando pensamos desde nuestra gestión en las políticas contra las violencias por razones de género, partimos de la convicción que cualquier política pública que apunte honestamente a erradicar las violencias debe abordar esas interseccionalidades y debe también problematizar y transformar las condiciones estructurales, materiales y simbólicas que sustentan y reproducen esas desigualdades. Para ello es clave un Estado presente, ¿no? Con capacidad y voluntad real de revertir las situaciones de desigualdad y discriminación entre los géneros. En este sentido, me interesa compartir algunas de las experiencias que en esta materia tuvimos en este primer año y medio de gestión. Lejos de ser abstractas, estas convicciones se materializaron y materializan al ordenar y dotar de sentido a las acciones que establecimos en el Plan Nacional de Acción contra las Violencias por Motivos de Género, que presentamos en julio del año 2020, luego de un amplio proceso participativo y federal. Con este plan buscamos modificar el paradigma de abordaje individual de las situaciones de violencia por motivos de género y avanzar hacia la construcción de un abordaje integral e interseccional que permita crear las condiciones para que las personas en situación de violencia por motivos de género puedan desarrollar un proyecto de vida autónomo. De ahí que el acceso a la vivienda, a la formación laboral, al empleo, forman parte de estas definiciones de políticas de protección. Siguiendo la consigna del evento, quiero hacer mención a un hito fundamental dentro de las políticas emprendidas, que ha sido la creación del programa Acompañar, el primer programa de acompañamiento integral y de asistencia económica destinado a contribuir en el corto y en el mediano plazo a la creación de condiciones básicas para la construcción de un proyecto de vida autónomo para mujeres y LGBTIQ+, que se encuentren atravesando situaciones de riesgo en contextos de violencia por motivos de género. Este programa es uno entre una amplia serie de políticas que se inscriben en esta concepción, que sostiene que las acciones en materia de protección deben ser integrales. Apuntamos a atender los casos más urgentes, pero evitando improvisar respuestas que sean aisladas. Queremos hacer foco en la prevención, de modo tal de contribuir justamente a conmover la violencia machista. Y esto supone claramente deconstruir y transformar esos patrones sociales y culturales que moldean los estereotipos en las relaciones entre los géneros. Este es el camino que venimos trazando en Argentina. Somos conscientes que el desafío es enorme y que se complejiza cada vez más. Sabemos que las desigualdades y las violencias por motivos de género son estructurales y no respetan fronteras geográficas. Pero tenemos un largo recorrido de luchas que nos antecedieron y de maestras que nos enseñaron a tejer redes, a escuchar atentamente, a pensarnos colectivamente, a ser tenaces y perseverantes en la exigencia de una vida libre de violencias. Muchísimas gracias.
I'm Khansa, and I'm a singer, songwriter, and dance performer from Lebanon. What is feminine? What does it mean? So-called feminized labor, nursing, street vending, agricultural work, and caregiving, frequently unpaid, is too often demeaned. It is overlooked as work. It is considered disposable, unworthy of the rights, privileges, and protections granted to those doing stereotypically masculine work. Gender and sexuality justice is not just a social issue. It is a labor issue, and it's a human issue. I stand with workers of all genders everywhere.
In 2019, the International Labor Organization introduced Convention 190, the first international treaty to recognize everyone's right to a workplace free from violence and harassment, including gender-based violence and harassment. To date, only 7 countries have ratified the convention and thus enshrined it into their laws. Now, we're going to hear from women on the front lines of the long and challenging march to broader ratification.
Good morning. My name is Shirley Price. I'm the president of the Jamaica Household Workers Union. Convention 190 is one of the most important conventions since the existence of the ILC. It is the convention that supports everyone. Every single one. It is very inclusive. Violence and harassment can happen anywhere and it can happen to anyone. But today I'm saying this must not be tolerated no more. It must stop. Time come for changes. Let us work together to educate, to eradicate. Let us fight and fight to win, to make sure violence and harassment is eliminated in the world of work. We need sweeping changes, and this must be now. We need legislative changes. Time come for it. Let us push together for government to ratify this very important convention. We need to work together.
Mi nombre es Claribet Palacios García, soy de Colombia, actualmente la presidenta de la Unión Afrocolombiana de Trabajadoras del Servicio Doméstico, más conocida como UTRASD. Llevo en el trabajo doméstico alrededor de 28 años de labor. Por esta razón me encuentro facultada para hablar de la violencia y el acoso en el lugar de trabajo y la discriminación étnico-racial. Estos fenómenos por años han venido atropellando la vida de las mujeres trabajadoras domésticas. Y en el marco del COVID-19, una vez más se ha puesto sobre el tapete la cruda realidad de las trabajadoras domésticas atropelladas por estas situaciones. Por esa razón, es importante que los gobiernos adopten ya el convenio 190, que lo puedan ratificar e implementar medidas afirmativas para que disminuya este fenómeno hacia las trabajadoras domésticas. Lo que ocurre con las trabajadoras domésticas en el mundo también es tu problema. Alguien de tu familia puede estar viviendo violencia y acoso en el lugar de trabajo y discriminación étnico-racial. Por eso, este problema también es tuyo.
Mariana es madre de Amador. Ambos viven en un departamento de 2 ambientes en el barrio de San Cristóbal de la ciudad de Buenos Aires. Hace 3 años se separó del padre de su hijo y se vio envuelta en el torbellino de reorganizar su vida. La dimensión del placer y de la satisfacción quedaron suspendidas en un plano lejano. Con un niño pequeño a quien cuidar, las desigualdades se llevan en el cuerpo. Todas las tareas invisibilizadas bajo las paredes del mundo doméstico aparecen como destino, como si las mujeres tuviéramos habilidades naturales para cuidar o para maternar. Durante el año 2020, la Dirección Nacional de Economía, Igualdad y Género Argentina dio a conocer que a nivel nacional 9 de cada 10 mujeres realizan tareas de cuidados, lo que significa un promedio de 6,4 horas diarias, 3 veces más que los varones. Y si lo llevamos a un marco económico, aportaría un 16% del Producto Interno de la economía argentina, más que la industria nacional, que el comercio y que el mercado inmobiliario. De los cuidados depende el trabajo de la reproducción, y eso toca inevitablemente los resortes de una estructura patriarcal capitalista. En nuestra sociedad No hay una distribución igualitaria de expectativas, ambiciones y realizaciones. Es urgente empezar a sacar los cuidados de la esfera individual, del orden privado y politizarlos para armar lazos colectivos y tramas comunitarias. Es hora de poner los cuidados en el centro de la política pública. Es nuevamente el sistema actual lo que hay que desconstruir y construirlo hacia una equidad más justa.
Hola, somos Colectivo Las Tesis de Valparaíso
y apoyamos a las, los y les
trabajadores esenciales en todas partes.
Hello, I am Walden Bello from the Philippines. Essential workers are what they are described, essential. Without the frontline health workers, delivery workers, the food workers, and so many others, we would have been overwhelmed by COVID-19 by now. Yet, the authorities often do not give them the support and respect they deserve. Take the case of health workers in the Philippines. The salary increments and hazard pay they have been promised months back still have not been released. Many are increasingly desperate, since being among those with the highest risk of being infected, their families are a meal away from hunger were they to get sick. Over the last few months, hundreds of healthcare workers have left the Philippines. You can't blame them, since the failure of government to deliver their benefits and the compensation packages being offered by recruiters from rich countries is a very tempting combination. Who can blame them if they say goodbye, since they act not out of selfishness, but out of concern for their families? Our healthcare workers and other essential workers are putting their health and lives on the line. Let us give them the support, respect, and solidarity they deserve. I thank you.
This past year was really rough for a lot of essential workers out there. Here in Los Angeles, California, a lot of street vendors were hit hard by the pandemic. I collaborated with LACMA, the Los Angeles County Museum of Art, and Snapchat, using new technologies to create an AR lens to depict a new monument and create support and advocacy for LA street vendors. I took a whimsical approach to it, having fruteros float down from the sky, a bucket of flowers sprouting out petals, on the horizon you can see an elotero cart floating by, and you also can see a paletero cart approaching you with these large-scale paletas popping out. And all around you in this 360 view, this naranja would bounce around. This experience being impacted by the pandemic has been experienced by all universal essential workers. We must all come together to make sure that workers are at the heart and how we build back after COVID. Thank you for watching my video and learning about Vendedores Presente. I hope my project can bring further support and awareness to our valuable community of street vendors and essential workers all around the world.
Up next, two unstoppable women with a bold vision for embedding social protections for the most vulnerable workers and their families. Having social safety nets are fundamental in any society, and their lack thereof was magnified during the COVID-19 pandemic.
Good morning, everyone. I'm Rosa Pavanelli, General Secretary of Public Services International, the Global Union Federation, organizing 30 million workers in 156 countries in public services. And I'm very pleased to be here with Rosa Omamo, from Kenya. She's the General Secretary of the Metal Workers Union in Kenya. And good afternoon, Rosa. First of all, how is being a woman in Kenya leading a male-dominated union?
This is a metal workers union that is male-dominated. We organize 90% male and only 10% female. And, it is really something that surprised Kenyans because they've never had a general secretary, a woman in a male-dominated union. And the first thing they would ask, how could she get votes? And actually men have seen that female are good leaders. They have good vision, and they are able to take good care of the workers by making sure that they defend their rights. Actually, it's not easy to compromise a woman in the same way that you can compromise a man. So the men around have really put their trust in me, and we are doing marvelous work together.
But now we are here also to talk about our point of view, our perspective of what we see can be the post-COVID world, the recovery after COVID. We have been hearing in the past months that nothing will be as it was previously before the pandemic, that we need to build back better, and that we need to recognize a different role to the fundamental things, to things that really matter for people. But from my perspective, what I see is that there's a rush not to build back better, but to make business as usual back again. So what you see from your perspective in Kenya that has been affected so severely by COVID, that has been affected by loss of jobs, 1.7 million jobs lost during the pandemic. And I had the experience of health professionals that have been fired during the pandemic because they were protesting for having to take care of patients without personal protection, without equipment to protect their health.
Right now, you see, Rosa, we are talking of a new normal. Home has become a workplace. So is that home conducive for work? Can we have decent work at home? Can the employer take the responsibility to make sure that the home that is now a working place has all the facilities required to be able to work at home? And for those of us who are multitasking, it is such a challenge, my sister. And the issue of gender-based violence at homes during this pandemic period has also costed a lot of women their lives here in Kenya, because so many women here in Kenya have been killed during this pandemic by their spouses, so that the work you do at home is decent work. Issues of social protection are issues of concern, because you find that at this particular time of the pandemic here in Kenya, our National Hospital Insurance Fund does not cover COVID-19. And so it then means that if you are affected, you have to go deep into your pocket to treat yourself. The hostels are full. So I want to tell you that as unions, we have different roles and responsibilities that we need to play. And we must make sure that we are involved in policy making decisions.
And this brings me to some of the discussions that are ongoing right now, where rather than say build back better, we should say we need to build differently the society that we have. You mentioned the need for social protection, the need for a health system that is universal and that allows free access to cure, but also the care aspect, taking care of children, taking care of elders, taking care of the family, sharing the burden of the family is something that needs to be done differently. We in PSI have launched a program that refers to redesigning the social dimension of care. I don't like that we talk about care economy, because care, yes, it turned out to be a big business, an economic factor, but is essentially and first and foremost is a need of the individual, is a human need. And this is why we think that we need to talk about the social care and involve government to deliver care services. Of course, we need resources to do that. We need resources. There's discussion about the creation of a global fund. But first of all, I think it would be very important to ask a company, to ask corporates, all the corporates, to pay tax in order where they make business, where they make profit, in order to ensure that the community can benefit of that work, and not just the company that are making profit and taking their money in tax havens or elsewhere, reinvesting in the society.
I don't see it different from you, Rosa. So it's not an issue that you will say it's only for trade unions to look at. It's not an issue that you will say it's only the employers or the society, but it is us together with the government to work together towards ensuring that it works for us. So that is what I can say specifically on the issue of care and corporate in regards to tax payments. The revenue is very important for us. And that is the only way that we can get universal health care. It is the only way that we can make sure that the pillars of social protection and the pillars of decent work are realized in our countries. Because social protection is a pillar of decent work.
Yeah, I totally agree with you, Rosa. And if we need to build a world where we are able to face challenges such as another pandemic or climate impact, the climate change impact, we need to think to a world where there are less privileges and more equality. And more equality starting from recognizing the role of women in our communities and in our society.
So I want to agree with you that we now need to start thinking along that line and make sure that women are at the forefront of pushing for review of laws and regulations in their countries and making sure that they participate in policy-making decisions. And I do tell my sisters around here that our times to be in the bedrooms are gone. It is time for us to be in the boardrooms and make sure that the policies that are changed works well for the women.
So there's a lot of work, my sister. It has been a short chat we had, but so many things in common, so many things we can continue to share, and from our different perspective, continue to build bridges for a better society. Thank you so much.
Rosa, thank you so much. I hope we will have a network that will bring us together always, and we will share more about some of the things that we are doing, and we can also copy a lot from you, from what you are doing. And so I'm proud of you, my sister. Thank you so much.
Thank you so much. Thank you, Rose. Good luck for everything. All the best.
As Rose and Rosa put it so eloquently, business as usual is no longer an option. Next is someone making groundbreaking changes in how women factor into the national economy. Mercedes D'Alessandro of Argentina.
Welcome. I am here with Director Mercedes D'Alessandro. She joins us from Buenos Aires. She is the first National Director of Economy, Equality, and Gender at the Ministry of Economy for Argentina. She is a feminist economist, having studied and received her doctorate from the University of Buenos Aires. She was recently noted as one of Time Magazine's top 100 people in 2021, and her work has been written about in the New York Times. She's also the author of Feminist Economics and How to Build an Egalitarian Society Without Losing Glamour. Thrilled to have you with us here today, Dr. D'Alessandro. Looking forward to hearing about your important work. So, Director D'Alessandro, let's start by hearing from you about the historic post that you hold, created in 2020. Why was this post created, and what is your ambition in this role?
Bueno, el espacio que hoy me toca crear, o que creamos en el año 2020, resulta de las demandas y las luchas del feminismo en la Argentina. Cuando el gobierno de Alberto Fernández y Cristina Fernández de Kirchner, que asumen en el año 2019 en la Argentina, llega al poder, llega también en el marco de tomar la agenda feminista como una de sus promesas de campaña, y eso genera de alguna manera que ese compromiso con la lucha feminista se convierta en instituciones. Una es el Ministerio de las Mujeres, Géneros y Diversidad, y las otras son las creaciones de espacios, como el que coordino yo, de la Dirección de Economía e Igualdad de Género dentro del Ministerio de Economía, que tienen como objetivo que las políticas públicas tengan perspectiva de género. Y en mi caso, que las políticas económicas contribuyan a cerrar esas brechas de desigualdad que, bueno, que las mujeres y los movimientos feministas en Argentina reclamamos hace tanto tiempo.
Thank you. And importantly, as you said, this effort is placed within the Ministry of the Economy. And so, yes, it's about gender, but it's about equality, and it's about the economy overall. And we know that women make vital contributions to the economy, and when they are hindered, that the entire economy suffers. I have a statistic here from your ministry, results September 2020, saying that unpaid care and domestic work, 3/4 of which are done by women, account for nearly 16% of the GDP. During COVID, I know women faced extraordinary setbacks. Could you talk about what you saw in Argentina and the responses of your ministry?
Sí, nosotras tenemos un diagnóstico que viene también de estas discusiones en el feminismo, que es que las mujeres realizan dedican 3 veces más de tiempo a las tareas de cuidado, lavar, cocinar, planchar, cuidar a los niños, a las niñas, a una persona con discapacidad, a un adulto mayor, y son tareas que suelen considerarse culturalmente como tareas de mujeres, tareas femeninas, y además tareas que se hacen de manera gratuita, que no tienen ningún tipo de remuneración. Lo que ha sucedido durante la pandemia es que nosotras veíamos que esas tareas se recargaban, porque en la Argentina, como en gran parte del mundo, una de las formas de luchar contra los contagios y el COVID fue disminuir la circulación. Disminuir la circulación fue cerrar algunos espacios de trabajo, hacer trabajo remoto y también cerrar escuelas, jardines, lugares en donde los niños y los adolescentes pasan mucho tiempo, y esto significó que los niños se queden en los hogares. Y que se queden en los hogares significó más trabajo para estas mujeres, que son las que realizan la mayor parte de las tareas de cuidado. Si le pusiéramos ese precio y la comparáramos con los otros sectores que producen en el Producto Bruto Interno de un país, esto pesa al 16% y en la pandemia se suma más tareas y va al 22%. Y esto fue una manera de mostrar para nosotras, con números, una realidad muy contundente que tiene un gran costo para las mujeres. Porque lo cierto es que ese aumento de tiempo que las mujeres tienen que dedicar a los cuidados significa también una menor posibilidad de salir a buscar trabajo, de continuar con sus puestos de trabajo, que desarrollar su carrera o de estudiar, de terminar una carrera universitaria o también de tener tiempo libre, ¿no? Y entonces para nosotras eso que se hace naturalmente en los hogares tiene en realidad un impacto económico muy fuerte. Y la pandemia, a pesar de todas las cosas malas que nos trajo, algo bueno, entre comillas, que podemos decir es la oportunidad de mostrar que este trabajo es fundamental y que sin este trabajo y sin todo este trabajo que hacen gratuitamente las mujeres, no hay economía que resista, no hay tejido social que resista. Y a partir de eso tenemos los desafíos de mostrar, bueno, que esto existe, que no está remunerado, que recae simétricamente sobre las mujeres, que impactan su vida económica, y bueno, ¿qué hacemos para mejorarlo? Que es todo lo que viene después de esto, ¿no?
And Dr. D'Alessandro, I know you've done even more than show, and congratulations to you and your ministry, because the UN noted that Argentina is the country which has had the highest number of gender-sensitive responses to COVID. So clearly there's a lot of action underway. Can you talk about some of the solutions that are in the national planning process and in the national budget to address these issues that you talked about that affect women?
Bueno, una de las cosas que hicimos que a mí me hace sentir muy orgullosa y relacionado a esto que mencionaba, hay muchas otras, pero muy relacionado a esto que mencionaba, bueno, la precaria inserción laboral de las mujeres. En la Argentina, las mujeres, gran parte de las trabajadoras son informales, es decir, no tienen todos los derechos laborales plenos, y el sistema de pensiones en la República Argentina implica que solamente las trabajadoras formales pueden aportar anualmente para luego, al final de su vida productiva, retirarse y tener una pensión. Bueno, la forma en la que se insertan las mujeres en el mercado laboral hace que no puedan pagar los 30 años que requiere el sistema de pensiones en la Argentina, y solamente hoy en la actualidad solamente 1 de cada 10 mujeres en edad de retirarse del mercado laboral estaría en condiciones de percibir esta jubilación, ¿cierto? Ahora, junto al ANSES, que es el organismo que trabaja la protección social en la Argentina, lo que hemos hecho es una nueva medida que reconoce que muchas mujeres, por el hecho de ser madres, se han retirado del mercado laboral para cuidar a los niños y niñas, que eso ha significado una penalización en términos de sus carreras laborales, que les ha quitado la posibilidad a veces de crecer, de tener mejores salarios o de tener un empleo formal, y entonces el Estado argentino le reconoce por cada hijo o hija 1 año de aportes en este camino para poder jubilarse, y eso de alguna manera es entender que ese trabajo que las mujeres han hecho cuidando a sus chicos, cuidando en sus hogares, retirándose del mercado laboral.
Directora Alessandro, these are such important solutions to look at the contributions of women in terms of caretaking and in terms of caring for the community itself. It's so interesting to hear from you about this, and congratulations on the forward progress that you're making within the Ministry of Economy for the good of the entire economy in Argentina. Thank you for being with us today.
Gracias a ustedes por interesarse en estos temas y ayudar a difundirlos para que podamos aprender entre todas.
Thank you so much for joining us, and be sure to tune in tomorrow. We'll hear from essential workers about what they are doing and what you can do too to ensure that essential workers have a seat at the table and that the policies being developed as the global economy builds back from this pandemic put the rights of essential workers front and center where they belong.